With PrimaryOne Health, patients in the Central Ohio community are provided with primary health care and support services which not only enhance the health and well-being of the individual and their families, but also promotes our belief that a community cannot call itself great without improving health outcomes so that children and adults are ready to learn and ready to earn.
I love particularly working at PrimaryOne Health because there's a sense of belonging. Patients come from local community, you feel that you belong to them and you have a personal relationship. I know my patients, I know their families, and it's something that goes beyond patient-doctor relationship, and that's what I enjoy the most here.
I came from Ohio State University to join an FQHC and for many reasons, one of which is the care which we provide our patients. Our mission is to allow access to care to anyone who has barriers. We've been able to do a great job with that through multiple resources that we bring.
PrimaryOne Health provides basic primary health including dental, vision, behavioral health, and OBGYN for its patients and community, and specialty services like dietary education, physical therapy, and cardiology services. These services are provided to over 35,000 patients annually.
Well, we're really excited about the new options that are available to our patients. One area is integrative health. One of the critical factors of mirroring up behavioral health care with primary care, operating from the same set of standards for each, but both complementing one another. So when a patient checks in and gets help for a general screening of an issue, they're able to receive some mental health counseling probably right there before they meet with the primary care doctor alongside a primary care doctor.
As you may or may not know, in Ohio, in the state of Ohio, and particularly Columbus, we have some of the highest infant mortality rate in the nation. PrimaryOne Health has taken the lead role in making sure that those numbers are dealt with and reduced over the next few years. Many of our centers in which we serve have patients in the so-called targeted areas. And so what we have done is we have made sure that those patients who are in the targeted areas have access to prenatal care, have travel arrangements, and have barriers that are removed so that there are no reasons why those patients can't receive the quality care that they so deserve.
We are one of the very few FQHCs, federally qualified health centers, in the country that offer physical therapy. And we're capable of treating many conditions here, from musculoskeletal to neuromuscular, cardiac rehab, pretty much any system that you would treat in a typical outpatient basis. So essentially we are establishing the model here at PrimaryOne Health in Columbus, because we don't really have another model to follow in terms of billing and logistics and how the physical therapy clinic will run.
Or like the PrimaryOne Health site at 1180 East Main Street, where dental disease prevention and treatment is possible for patients who need it. And vision care, with a full optometry suite where patients are provided with eye exams, diagnosis, treatment, and frames and lenses at our full-service vision centers located at both our East Main and West Side location at 2300 West Broad Street. And for our residents in Pickaway County, we have a PrimaryOne Health site in Circleville to provide primary and specialty services.
We are one of very few vision centers that are incorporated within an FQHC. Less than 17% of federally funded health centers actually have a vision center, so we're unique in that way. We have a comprehensive set of doctors. We have 3 doctors that operate within the system. We all provide comprehensive eye exams, including a full optical. We treat emergencies, and we also treat many eye diseases and act as a referral system.
The uniqueness about PrimaryOne Health is that we have many services that other health centers don't offer, and that was the unique thing about vision. In the beginning, 18 years ago, we were one of 2 in Ohio that had vision, and sad to say there's still very few vision clinics with FQHCs. So that's one uniqueness. We also have grown over the years. We started out very small, and over the years we've grown to add 2 other optometrists as well as another health center.
10 sites providing high-quality, comprehensive care, support services, and staff that are dedicated to helping people and providing top medical care to our patients. Our support staff of nurse practitioners, nurses, lab techs, and administrators provide top-notch care the entire year round. These dedicated professionals led by our board of directors make a difference in our community every day.
Being a board member and patient is kind of unique in itself, where I get to see what the patients, what their needs are, where they have issues, and we get to sit at the table and address those issues on a monthly basis. Being a patient, I'm getting my health care and all of my needs addressed at the same time. But even when I have issues and I see things that other patients see, I can also bring those to the table at our monthly meetings to have those issues addressed.
What's unique about being on the board is that I'm a patient, and 51% of the board are patients, and they come from diverse backgrounds, ages, gender, and by being that, I think we have good input and insight on how a patient should be treated.
PrimaryOne Health has expanded our partnerships to ensure that we're providing for all of the needs of our patients. We have partnerships with the Mid-Ohio Food Bank to provide fresh fruits and vegetables, partnerships with Columbus Public Health, providing dental services, and certainly STD and other kinds of surveillances of diseases and illnesses. We also have partnerships with the Central Ohio Diabetes Association to provide comprehensive education around diabetes. We have expanded our care, but we've also ensured that we've expanded health insurance with our certified application counselors. These are individuals that help individuals within our community enroll into Medicaid or the market exchange. And we are a part of the Southside Renaissance here on our Parsons Avenue location, which is in the John Maloney Health Center.
We are incredibly grateful for our partnership and collaboration with PrimaryOne Health. When Matt Habash, Mid-Ohio Food Bank CEO, and Charleta Tavares got together, they truly understood that food is health and the connection between food and health.
Through partnerships like this, we're able to make sure that all have access to the fresh fruits and vegetables that they need so that they can lead healthy lives.
You know, the whole face of hunger has really changed in our community. It's our coworkers, it's our neighbors, it's who our kids go to school with. And so by collaborating with PrimaryOne Health, we truly are able to look and work with the whole person.
PrimaryOne Health is one voice, one system, and we want to be your first choice for quality care.